Ready? Okay, good afternoon, everybody. And thank you all. To plan to get us from here to there. And it's a reliance upon expertise to guide our thinking so that when we do say it's safe to return, we have confidence. We want parents to have confidence that when we say it's safe, they know it's safe. So today we're joined by two experts, both are pediatricians. One is Dr. Jim Mcdonald, who is probably by now not a stranger to anyone. He's been a fantastic partner to me and my administration all the way through. He works at the Department of Health, so he's a public health expert, but he's also a pediatrician and someone who I think we all have grown to have faith and trust in. The other is Dr. Elizabeth Lang. Thank you, Dr. Lang, for joining us. Also a pediatrician with decades of experience and a very large practice, and the former president of the Rhode Island chapter of the American Academy of Pediatrics. So thank you, doctors, for joining us, and thank you for guiding us in the right direction as we go through these very difficult decisions. Our top priorities are kids, keeping them healthy and safe in all regards. So we want to thank you. So I look forward to a good discussion here. I want to first turn it over to Commissioner Infante-Green, who's leading this effort, and just give you an opportunity, Angelica, to offer a few words.
Sure. Thank you, Governor. I'm really excited to be here with two pediatricians that can offer their expertise. But aside from being the Commissioner of Education, I'm also a mom. You know, I have two kids, and my husband and I rely on the advice of the experts from our kids' doctors, especially to navigate these challenging times together. So these conversations are going to be really important as we move forward, for all parents to hear, for us at the Department of Education. But when it comes to the health and well-being of our students, there's nothing that matters to us most than the students' health, which is not just the physical health, but it's also the social, emotional. It's having a very safe place for our kids to come back and thrive, have access to well-balanced meals. So all of this is what is important to us as our kids come back to a safe environment where they can grow and learn every day. I'm really proud of our leaders, our teachers, our families for putting student safety first in the last few months as we set the national example for conducting distance learning, but also keeping the focus on our kids' continuous learning, moving forward, growing. But at this point, we're relying on the experts to help us navigate and do what's right for our kids and our families. So thank you very much, Governor. I'd like to turn it over to you so we can start this really important conversation.
Great, thank you. So I will start with you, Dr. McDonald, but I'd like to give you both an opportunity to answer this question. The question on every parent's mind is, what's safe? Is it safe? What's safe? As parents, we're in the business of protecting our kids and managing risk for them. I will say my daughter turned 16 last week. I have risk top of mind the thought of her driving. Scary. So we're in the business of saying, how do we keep them safe, but also let them, live and experience the benefits? So speak to the parents out there who want their kids to go back to school, but they're nervous. How should they be thinking about it? How should they think about the risks of sending their kids back to school or leaving them home for distance learning?
Yeah, so thank you, Governor Raimondo. And, I'm a pediatrician, but I'm also a dad and a public health physician too. So if the health department's talking to you folks, we're always giving you numbers because that's part of what we do. And, one little framing number I have for you is we look at all the cases we've had in Rhode Island, only 3% of our cases have been in kids 0 to 9 years old. And, in the next group from 10 to 20, that's only 5% of our cases. Now, that's 8% of our cases in folks under 20. So it really hasn't affected children. And that's consistent with what you've seen in other states and around the world. Part of it has to do with, as you get older, you have these receptors in your nose and in your lungs where the virus binds to. They're called ACE2 receptors, stands for angiotensin converting enzyme. And that's where the virus binds. They're just not that prevalent in kids. And fortunately, the kids who have gotten sick have generally not gotten so sick they've ended up in the hospital. We've had very few kids go in the hospital, and mostly that was just to make sure things were okay and just to observe the children. So generally the kids have done pretty well. So I think from an epidemiology standpoint, when we look at the numbers, we haven't seen a lot of this particular virus in kids. And keep in mind, this is still a new disease. It's only been around the planet for 205 days. So it's just over 6 months. But by this time, we would have seen something, I think. And I keep in mind that the virus so far is acting different than other viruses. It's not acting like typical flu virus in so many ways. Flu is much more contagious in kids, but SARS-CoV-2 isn't as contagious in kids. Doesn't mean it can't happen, but we're not seeing that much spread in kids right now. Dr. Lang, what were your thoughts on that?
Well, thank you, Governor and Commissioner, for inviting me to participate in this forum. When we talk about a school day, we're talking about not only our children, but we're also talking about the staff and the volunteers and everybody else who is in that building. So when the state is discussing return to school policies and safety in school, we're truly talking about everybody because every life matters in that building. There is nothing that we can do to make the risk go 100% away. But with the right measures and with the right plans and with the right teamwork, we can mitigate the risks so that they are down to as minimal as possible. One of the things that is so disconcerting for all of us is feeling a lack of control. Our children are acting with understanding that this universe does not have their normal controls in it. And starting into September, we feel like back to school should be like it always has been. And we don't have that same energy right now as we're figuring out how to work with this new virus in our lives. But one of the things that we can do to make back to school as safe as possible is right now, we can all continue to wear our masks. We can all continue to socially distance. We can all continue to wash our hands. Because as long as we keep the level of virus low in our state, we are setting our children and our schools back up to going back into the environment where we don't have as much disease and illness in this state as other states are experiencing right now. So while we do all the planning that we're doing, there are things we can literally be doing right now, each and every day, to make sure that school has the least amount of risk as possible.
Yeah, by the way, that's how I think about it also. Like there's no risk-free, there's no such thing as risk-free. So what do we need to do to reduce the risk so that it is safe? Tell us, Dr. Lang, what have you been seeing during COVID-19? What trends have you been seeing among the children that you treat in terms of physical health, mental health, immunizations? What have been the effects of COVID on these kids?
Sure, thank you. The pediatricians of the state and the family physicians who see children have been working really hard this summer at catching up well child visits and bringing children in for their vaccinations. We know that this pandemic has uprooted all normalcy in all of our lives. And what we're seeing in the exam room is the children are no different. They are feeling the stress of the lack of routine and the lack of structure. That is manifesting in children oftentimes being up all night and sleeping all day. It's manifesting in children having more screen time. They needed to be on their screens to finish the online schooling that our teachers nicely put together for them last semester, but that screen time has continued in their lives. And knowing that there's a virus out there, many kids are afraid to go outside because we have talked so much about this virus and being safe and staying away from people that for many children outside doesn't feel like a safe place. So they're staying indoors, which means that they're sedentary, which means that they're near their refrigerators. As I look at the growth charts of children growing this summer, it is the rare child who has not gained more weight than I would have normally expected in a year, because we've all done pandemic eating for a variety of reasons. For most of us who have been lucky enough to have enough food at home, we've not always had the right kinds of food, and our emotions have, and our boredom has caused us to eat different kinds of food. So there are lots of reasons why getting back to some semblance of a new routine is important for children's health.
How are we doing with the immunizations, by the way? That's something I had been worried about. Are we getting back to where we need to be?
We are actually, the pediatricians of the state, there are about 200 of us who are literally working morning, noon, and night, and extras on weekends to bring children in for vaccines. We have worked very hard to make our offices as safe as possible. For those of you who have brought your children in for an appointment, you have noticed that we have social distancing. We are checking people in from the parking lot, having nobody wait in the waiting room. We have one-way traffic in our hallways, and have minimal interactions with the staff as well. So we are trying to get children in as efficiently and as safely as possible to catch up on vaccinations. But we are making great progress, and our goal, the Rhode Island pediatricians have committed to the governor that we will have all school vaccinations up to date on the majority of children that we can by September 1st.
The governor thanks you so much. I know it's been a heavy lift, and I'm so pleased to hear it's happening. But thank you for the creativity and the extra hard work. It's what you're saying before. If we can begin school with a place of higher immunizations, people being healthy, low prevalence of coronavirus, will be in a better base place to begin.
Well, I think this experience is teaching us that vaccinations are important. This world is truly upside down right now because we don't have a vaccine against coronavirus. So it would be a real shame to have a flare of measles or meningitis because children did not have access to the vaccines that prevent the diseases that we have vaccines for. So we appreciate your support, Governor, in helping us in this effort.
Yeah, absolutely. So Dr. McDonald, question for you. You hear parents saying, parents are trying to figure out, what do I do? What's best for my kid? And some of them say, I don't know what to do. I think it's just safer to stay home and just do distance learning. What's your response to that?
I think it's understandable. And I think right now, when you look at how upside down the world is and how topsy-turvy things are, I think we're looking for what's normal. And I think, home seems normal, but home is great, but kids are used to routine. So most kids are used to, in September, going to school, having breaks and coming home. And that's what kids are used to. And getting back to normal has value for everybody. And when I think of all children in my state, I also think of all of a child. And, one of the things I think about with all of that child is there's that social component to learning, that peer-to-peer, I think we all remember you learn a lot from your classmates, whether I was in elementary school, high school, college, or medical school. A lot of times I learned so much from my peers. I form relationship with others. When relationship leads to trust, and trust leads to really good learning. The other things I think about is just, school is so much more than just that cognitive presence. For a lot of folks, it's where there's meals, and it's where there's relationship with teachers, and it's where bonds are formed that are really powerful. And, teachers are important, ethical, and important role models. One of the things I think about, I remember being in 9th and 10th grade English. My English teacher was named Jim Labat, and this is 43 years ago. I still remember it, giving in a scenario to the students of us, how much money would we take if we were to tell a lie, or something like that. And I was, we're all working through this little ethical issue, but as I worked through that, I was surprised at how much I would, how little much money I would take to have a lie. And yet what he was teaching us is how to be people of integrity. And I think about the man of integrity I became in my life was shaped by Jim Labatt, my English teacher. And, I still have a relationship with him today where we write Christmas cards and things like that. But I think about how teachers were such a profound ethical influence on me. And, all teachers have a profound influence on becoming the person I became, and the same we all become. And there's so much more that goes on in school. And it's really an important dynamic in a child's life because we learn from each other, we learn from our teachers, we learn about ourselves. And I think about the confidence that I got. One of the things, this may come as a shock to you, but I didn't really believe in myself when I was a kid. I was really someone who needed to have that confidence instilled in me. And when I got the affirmation from teachers, people I respected, that gave me the belief I could succeed. And I certainly would not be the person I became if I didn't have teachers who believed in me. And I think getting back to your original question, Governor, is like, if you're thinking about, should I keep my child at home or not? Homeschooling's not for everyone. I think one of the things I've seen in my own practice is a lot of the parents I've been talking to are like, this said, this was hard. Some kids just didn't take to it and it was just a challenge. And so I think they were like, we're really looking forward to school getting back together. And one of the things I think from the kids who I take care of is that the kids miss their friends, and it's not the same to iPhone or Zoom with your friends. They just miss being with them. And of course, we need the kids to learn new lessons, right? We're going to be 6 feet apart from each other. We're going to have our masks on. We're going to do some common sense things. And what the kids are going to learn, among other things, is like, hey, you know what? We have a social contract with each other. In other words, one of the things kids are going to learn when they go to school this year is we all depend on each other. And I think that's a cultural positive. If we can teach our children in this generation that we depend on each other, that is a profound positive that is going to be part of the new Rhode Island. And I'm excited about that positive because a culture that knows we all depend on each other is a culture that cares about each other. And when we care about each other, we grow better as a culture.
So true. So I have a question for both of you. I'll start with Dr. Lang. Give you a minute to think about it, Jim. You're both parents. You both have kids. So does Angelica, so do I. We're all going to be in the same boat in a month and a half. How are you, we'll start with you, Doctor. How are you going to make that decision for your children? And what are you going to need to know about the precautions at the school so that you're going to be comfortable saying, yes, I'm comfortable sending my kids to school? Because the commissioner and I need to hear that. We need to know what are the conditions that have to exist. So you're a pediatrician and you're a mother. What's it going to take for you to say, yes, I'm sending my kids to school?
I think part of what it's going to take is the grace from all of us that threshold and those list of questions are going to be different for each one of us. And the conclusion that each one of us makes is the right one for our family at that time. There is no room for judgment and finger pointing and yelling in this situation because we are all at different places on this journey. We all have different stressors. And to build on Dr. Mcdonald's point, the sunshine that can come out of this new world is that we all care about each other and we respect where each other is coming from. So for me personally, and what I'm hearing from my patients is they want to know what mitigation factors is the school implementing to keep children healthy. Are they screening temperatures at the door? Are the desks truly 6 feet apart? What's happening with the meals? What happens when somebody is sick? How is the school nurse teacher involved in that? What is the busing or transportation like? What are the other options if I decide at the end of this journey that I really cannot send my child back to school? What options do I have? Do I need to join a homeschooling club, or is the school department going to work with me to help teach my child at home? Will school be will be closed abruptly again like it was in March? I'm a working parent. I need childcare, and school is a part of childcare for me and for so many other people in the state. So while we can't predict everything that's going to happen, and we actually can't predict anything that's going to happen, but we can at least try to be patient and have a couple of scenarios in place. So if I do need to all of a sudden work from home and teach my children, what are the options for that? So there are lots of things that kids need to need to know about. And I say kids in particular too, because we're just talking about parents, but kids have very different questions. So the parents have one level of question about our adult understanding of safety. What are our kids worried about? As parents, it would be helpful to not project our worries on our kids, but instead to say in an age appropriate way, what are you worried about? What do you want out of school? What is a goal for you come September? And having that kid focus in mind and the parent focus in mind, the family can build the best option for that family, and the commissioner and all the school departments can try and do the best that they can starting September.
Yeah, well said. Thank you. Dr. McDonald?
You know, so Sarah is 18 and she leaves for college on August 15th. So emotionally, mommy and I are getting ready for that kind of thing. And it's a big deal. First child going away to college. So one of the things that we've looked for is what's the prevalence? In other words, how many cases are there in the county? Turns out pretty low. So Sarah's going to Gordon College in Massachusetts. And, you know, one of the things that about Sarah that I think makes her low risk is she's really smart, but she's also a rule follower. Like Sarah watches her dad. Sarah knows she's going to wear a mask. Sarah knows she's going to use hand sanitizer. What's fun about being a dad sometimes is my kids actually help me. Like one of the things Sarah's really good at when we get in the car, she's got the hand sanitizer right there for me. So Sarah's good at following rules, but the reason she's good at following rules is I've taught her that. And I think that's one of the things that I think as a parent, I'm teaching my children how to follow rules, not just to protect her, but to protect all of us. And, you know, it's a little bit easier for us because, you know, my wife is a high-risk individual. As a cancer survivor, we have to be very careful about protecting mommy. We don't want to put mommy in jeopardy. So my kids have latched on this lesson well. I think the other thing I've seen that's been really reassuring to me is the college she's going to, Gordon, has been giving us emails pretty often about what they're doing. They've got a coherent plan that makes sense. And, you know, I don't know that they're going to stay at school the whole semester. No one can promise that, but they adjusted their school year. They've got different plans for how kids are going to move through transitions. And they've got everybody being tested before they go. So they've got a comprehensive plan for all these students coming from all over the world to their college. Now, when I think about elementary schools, high schools, a lot of these things are the same concepts. When you look at the prevalence of disease in Rhode Island right now is, you know, fortunately at the moment, we are not one of the 34 states with a high positivity rate of cases. We're well under 5%. We're running around 2% of cases. So fortunately in Rhode Island right now, most of us are heading in the right direction. I think it's really important over the next 6 weeks while we're getting ready for school to start. This is not at all a time for people to be less vigilant. It's a time to be more vigilant. And I think it's one of those things where it's really important for people, if you're not comfortable wearing a mask, can you ask yourself why you're not comfortable and maybe look at, maybe I can become more comfortable. Because, you know, telling someone to do something and becoming aware of changing isn't something that just all of a sudden all of us change. None of us do that, by the way. Just because all of us knew smoking was bad for us, we didn't all just quit smoking. We had to get to a certain point. That's called the trans-theoretical model of change. In other words, we all need a little help sometimes. So I'm a strong believer in encouraging and educating our neighbors in a friendly, kind way, just to move in the right direction. And I think we're seeing more and more of that. Like one of the things I see in the state more and more is people are staying 6 feet apart. They are wearing their masks. I do see people walking around with hand sanitizer. And I have to say that we wouldn't have the low positivity rate without that conduct. In other words, people are changing. And it's really important to understand this, that it's the population that's keeping us healthy, because the population is changing its behavior. You are all keeping us healthy. And so as a parent, I want to have that confidence. Now, right now I have that confidence, and I expect to drive my daughter to college on August 15th on a Saturday. I do expect to cry when I say goodbye, and that's normal and healthy. And mom and I are looking forward to that life experience with the daughter.
Commissioner, I want to give you the last word. You and I have been listening here. We have the tough job of helping get schools ready with superintendents. What would you like to add or ask?
I think that I want to thank both of you for giving us all this information. And what I'm hearing is that we have to keep the information coming, answer some of the questions that you put out there, because if you're really worried about the mental health of our students, and it would be great if you could speak just a little bit before we get off about the things that you have been seeing and your hopes as we move forward.
Dr. Lang?
Thank you. Thank you very much for raising that. You're absolutely correct. In the last 3 months in the well child visits that I am doing, and pediatricians around the state, we're seeing an awful lot of anxiety. We're seeing an awful lot of depression. Kids are worried and they're sad. They're missing their friends. They're missing their routine. They're worried about mommy and daddy being back at work. They're worried about the change in the household finances with the unemployment rate. They're picking up all the stuff that parents are worried about, as well as their own social groups. So having some sort of a routine that feels safe and accommodating to everybody is important. But I also encourage families to reach out to the mental health system. The mental health providers of the state have been phenomenally accessible to help all children. With telehealth, these visits are very accessible and easy, and the insurance companies have been very supportive of that as well. So please have a conversation with your family physician or your pediatrician about your child's mental health. When the kids are back in school, advise the kids to talk to their school counselors, because this is an important issue we don't want to let go.
Dr. Lang, can I just build on that a little bit? Because I really appreciate what you're saying, Commissioner Green, about the mental health of our young ones. You know, from March to June of 2020, the percentage of kids who have gone to the emergency department because of suicidal thoughts is twice what it was the year previous. You know, in other words, that's something that we have to get our arms around, is that this has been a time of anxiety, and getting our kids back to normal and everything that feels normal is going to help reduce some of that anxiety. I think it's just important for us to understand that there's larger issues at play, and fear, it is the path to the dark side. You know, I don't know anyone who gets better being afraid. It's better just to talk to folks and understand what it is you're worried about, and then talk it through. And that's part of what we do as parents. And if we're a little bit concerned about things, we should have other folks that we can talk to.
Yeah, I like that. The path to the dark side. Okay, we said we would conclude at 3:30. It's 3:30 on the nose, so we will try to do that. I cannot thank you both enough, Dr. Mcdonald, Dr. Lang. Thank you. You're both enormously busy right now, and the fact that you're taking time to advise us and speak to our parents and students is a testament to your integrity and professionalism. So thank you both. Commissioner, thank you. We have a lot of work ahead, but we will do it. I do want to thank everyone for joining. If you have a friend who wasn't able to join, you know, send this to them. I think, listen, these guys are right. We have to talk more about it. We have to, let's go. We'll have a statewide discussion so that folks can have their questions answered. So we take our own journey to get to a place of confidence. Starting next week, every Wednesday at my 1 o'clock press conference, I will be devoting a portion of every Wednesday press conference to schools. Every week, we'll talk about our testing plans, our transportation plans, our quarantine plans, our symptom tracking plans. So if you're a teacher, parent, student, someone who's interested in wondering what's going to go on with school, Wednesday, 1 o'clock, governor's press conference, probably half or more of it will be dedicated to schools. So happy Thursday, guys. Thank you for being with us. Have a good day.
Thank you.
Live with Carnegie Hall is made possible by Hope and Robert F.